Travel nursing can bring you to places you've never been before. Tell us your story.
Hi. Well, better late than never. It's Rita at the Travel Nurse channel, and it's a little after 10 on Tuesday, the 25th. And so happy to be here with you all again and talk about all things that travelers care about. And so sometimes it's not always the pleasant stuff that we talk about. It can be some of the distressing things. So travel nurses, travel therapists, travel techs, we're all healthcare workers, right? So we're the same. So, well, we have similarities. And so if you're a traveler in the ICU, an ICU nurse, there are certain expectations of what you do. And if you're a nurse practitioner in the ICU or the ER, there are certain expectations and skills and processes and so forth that you're expected to perform when you travel. And so, so that piece, the technical or the what the employers the expectations, what you contract to do, the the actions that you do and so forth, that's going to be very similar to someone who's on staff, whether they're part-time or full-time, been there for years and years, they're a newer hire. The expectation for the skill and the performance are pretty much the same. But you're not on staff. You don't have the same sort of onboarding and mentorship and training and ongoing training that occurs when you're a staff member. If the facility is doing some special training, say some new equipment comes in or some new process is going to be in place, oftentimes travelers will be included in that new training. Potentially, for example, charting and computer and so forth. So a lot of that is not going to cause a hiccup, right? We expect you to take so many patients. We expect you to work these hours. We expect you to not be sick. We expect you to know your craft and your science and so forth. But what's different? When you're a traveler, whether you're an RN, an LVN, a nurse practitioner, you hold a certain certification, you are maybe have your doctorate in physical therapy or occupational therapy, all of these things that you are and you do and you contract to work as, the burden is on you, for example, licensure, for example, vaccinations. For example, what's going to happen during a pandemic? And one of the hiccups that was surprising as I go along looking at everybody's stories is that some travelers ran into hiccups trying to get their COVID vaccine. Can you believe it? There's some sort of light in my eye, but not much I can do about it. Let's see if we move the camera slightly. If I look down slightly. Okay, so obviously I am not a technical genius. Had a lot of hiccups today, even just getting seen on the camera. So I'm glad to be here. I'm sorry if it's not as clear as it should be. Maybe if I back up a little bit. Let's see if I back up. I used to have more lights, but a lot of them went out. Okay, all right, that's the best we're going to do. Yeah, so there are some differences, obviously, between being on staff and having the support of, say, HR and the various departments and managers and so forth, and being a traveler. So the expectation of the traveler is that you arrive with everything you need. Well, if it was the middle of the pandemic and well, now we're in the latter part of a pandemic, we hope that this is going to resolve itself. It's really wonderful that 20% or more of our population has been vaccinated, with the first tier being healthcare. But how did it work out for you? And I'm going to give you the story here of how it worked out for let me go back. How it worked out for a traveler. It was a struggle, actually. So I never give names because I pull these stories from different sites, and I don't know the actual people, but they're strong sites. They're particularly many of the things that I am researching are coming via news broadcast or the CDC or sometimes the World Health Organization, WHO, and various nursing blogs and organizations, and sometimes it's just directly from individuals. So this is from a blog, and it's got some basic nursing 101. And here's a nurse's story that is from January of this year, 2021. So according to the CDC, the Center for Disease Control, there was this phased allocation for getting the COVID vaccine. And hospital healthcare workers was supposed to be prioritized. They were the first tier, right? Okay. And so all of my cohorts and friends and acquaintances in healthcare, nurses and doctors and so forth, they were part of that first tier. And that happened, I want to say, within months of the vaccination coming out. So I want to say back in, I want to say like autumn, the fall of 2020, right? So that started happening. By December, pretty much all the healthcare workers would have and should have been vaccinated. And that was the priority. That's what the priority was. Let's take care of the doctors and nurses and healthcare workers so that they can take care of the patients, and so that we can avoid them getting the COVID-19 virus. Okay, so they were offered the vaccine by hospitals where they were employed. That's the thing. The contract for a traveler is not an employment contract, but a temporary contract to work as an employee while they're contracted. Unfortunately, travel nurses had different experiences. And then this is one nurse's story. Let's see if I can find the highlighted. Some of the travel nurses and travel healthcare workers were running into trouble trying to get their COVID-19 vaccine when the hospitals they were contracted with were only providing the vaccine to staff members, and travel nurses weren't included in that priority access. Complicating the matters, travel nursing agencies don't have access to vaccines either. And I'll give you a sidebar. My cousin in her late 50s wound up in the hospital, and we spent a lot of time in urgent care, and then we spent a lot of time in the emergency room, and eventually she needed surgery, and then she needed rehab. So she was in four healthcare facilities about a month ago in April, and April, maybe it was March. So we were a year into the pandemic. Her tier, they were starting to have vaccines for her tier in the 50s, but we were running out in local pharmacies and so forth. And here she was in 4 healthcare facilities, in urgent care, an emergency room, a hospital, and its medical surgical unit, and then in a skilled rehab. And none of them were able to provide her with the vaccine. And she spent well over a month in those 4 different areas. And I asked each and every time, I said, she's not vaccinated. Can we get her the vaccine? Oh, sorry, no, we're not doing that. So that was part of the issue. Certain branches of healthcare were able to distribute the vaccine. So here's a hiccup, a problem, an unusual occurrence that may happen to some of our wonderful travelers. So the travel nursing agencies didn't have access. The hospitals were not including travelers in their priority access to get the vaccine. And so here's one nurse's story, an RN who was traveling, and her story of jumping through the hoops to get her vaccine. And I jumped through the hoops for my cousin, who was finally admitted to a special community for her needs and, you know, her disabilities and so forth. And they couldn't do it either. And so I did the research. I found a convenient pharmacy that would provide it. I scheduled her for the 2 vaccines, and then I went to the director of her community and I said, are you able to provide the transportation? If not, give me a lot of notice so I can arrange my schedule. And they were like, thanks for making it happen. We'll arrange the transportation. Of course, then there were hiccups. Then they got lost and they found a parking lot instead of the pharmacy. Oh my. But she yesterday got her 2nd vaccine. So there you go. And she's in her 50s. So that was exciting. She'll be 60 later this year. Okay, so this nurse's story, she's a current travel nurse in Detroit, Michigan. She never dreamed that she would have difficulty getting the COVID-19 vaccine. But when she told her story to this blog, this site, that's what happened. The hospital she was contracted with announced vaccines would only be offered to all staff in December of 2020. She inquired about receiving the vaccine as a traveling nurse there during that date. And unfortunately, despite going through lots of requesting, she emailed, she requested personally, she was told that she would have to find the vaccine on her own. She contacted the Michigan Department of Human Health and Services. That's good. And it asked for their advice on how to proceed and how to procure this vaccine for herself. She was ultimately able to schedule an appointment with one of the county health departments and received her vaccine on the 29th. And as you know, the first vaccine, particularly oh, I forgot to turn off my phone. Sorry, folks. We don't want all that noise and knocking. I have a lot of knocking on my phone. Let's see. Turn that off. Sorry about that. The first, the Moderna and the Pfizer, they're a series of 2 vaccines, at least 2 to 4 weeks apart, and you get a lot of benefit from the first vaccine. You get probably 80 or 90% resistance. You get 80 or 90%. It instigates your body to provide the antibodies to the COVID-19. So you get a lot of protection from that first vaccine. So it's really critical. You want to get it. You want to get your second one as well. But anyway, by December 29th, she was able to get her vaccine. She explained that she's used to having to jump through additional hoops as a travel nurse. So then I wanted to keep reading. I'm like, why? Why isn't she feeling the love? She said, and this is a quote, "That is a fact. I accept and happily jump through the extra hoops as I get to go to some cool places," she says. So she accepts that as part of her travel assignment. Great attitude, I think. She points out that she always has to find and pay for her own flu shots, and she says it's understandable, but she believes the COVID-19 was a little different, and she did not want to be refused the COVID. Again, in quotes, "To be refused a COVID vaccine that the hospital paid nothing for is unacceptable." That's where she drew the line. And both travel nurses and staff nurses care for the COVID-19 suspected patients and the COVID positive patients. I fail to understand how any chief nursing officer can exclude travelers when we are working in the same conditions with the same patients side by side with the staff nurses. Another nurse pipes in, another travel nurse in Vegas. So that first nurse I was talking about was in Detroit, and in Las Vegas she had another nurse had a similar situation, and I quote her, "When I inquired about getting the shot at my current place of employment, the person I spoke with was from the education department, told me that the shot was for employees, and since I was a traveler, I was unlikely to get the shot. My plan is to try a different facility when I switch contracts to get the vaccine." So what's the solution here? Number one, I believe the solution, I turned this off and it's still knocking. Maybe I didn't turn it off all the way. Hit the button twice. Okay, now it's going to be quiet. By the way, folks, let me make sure we're live here. The Travel Nurse channel is live here today at this moment, and every Tuesday from 10 a.m. to 11 a.m. We're a little tardy today, so I'm going to hang on to 11:20 for anybody that's watching. But we're live on Facebook. We're also on YouTube, and we're also archived in those two places. So please check in with us anytime. If you want to be a guest, easy peasy, I can bring it. Well, easy peasy, I say. So sometimes it's just a matter of rebooting, and that's what happened today. I kept trying and trying and trying, finally turned the whole thing off, restarted it, and then we were streaming because the camera was on, computer was on, glitches. Anyway, I'd love to chat with you, but where I was headed with this little hiccup that can happen to a traveler, and we're talking about a current issue of being vaccinated for COVID, particularly when you're taking care of potential COVID positive patients and knowingly COVID positive patients that are presenting to you in whatever facility you're working at, whether it's long-term, short-term, acute care, emergent care, surgical, etc. That why would you have to jump through hoops to get something that is needed? Why would you be put at risk when you are up close and personal? It seems wrong. And so so we heard from two nurses that were traveling. One was traveling in Detroit, Michigan. One was traveling in Las Vegas, Nevada. And they were both sort of said, "Oh no, you're a traveler." So what's my recommendation? My recommendation is talk to your recruiter. Now we have a little bit more information. Now it is, we're well into almost halfway through 2021, and it seems to be readily available. There were shortages. I know this, one of the second tiers or third tiers were seniors, the elderly. And my mother is in a assisted facility. She really doesn't need a lot of assistance. And I'll just say a shout out. My mom turned 92 yesterday, and she's doing fabulous, and she looks fabulous. And if I could Zoom with her, I'd have her as a guest so she could talk about her healthcare experience, what she recalls of it, because she had a stroke about 10 years ago, and she's doing great. Yes, she has some deficits. She has she had a big left-sided stroke, so she has almost no control over her right side of her body, and yet she manages, and she laughs all the time. And we just celebrated her big 92nd birthday, and she's talking about 100. So yeah, so she had a couple of cakes and balloons and all the fun stuff. Anyway, so talk to your recruiters is what I suggest at this point. If you have to manage on your own, so be it. The vaccine is more available now. But say, what if you're in the middle of traveling and you've only had the one vaccine and you're going to be gone? Do you have to fly back out of town to get your second vaccine? So talk to your recruiters, work it out. They can be very, very helpful with you on your travel assignments. They can talk with the powers that be, whether it's the education department, the HR department, the employee health department, whatever department it is that is in charge of COVID-19 vaccines. And it is very specific. It is very specific to, I don't know the answers to this. In California, a lot of the university hospitals were sending in staff to the all the places that we had big outdoor facilities where they set up stations and they were giving the vaccine. You would drive through, you would get online, you would get, answer your paperwork. A lot of it was done ahead of time online. Your questions were answered, your data was inputted and so forth. So by the time you got to the site, the vaccinating site, you were just one of many hundreds of thousands of people that were scheduled, and it was pretty darn efficient, I have to say. And they used, in my area in Southern California, they used a lot of the University of San Diego staff, volunteers, and professionals to provide that. Now, for a traveler, how does that work? How do you know where to go? Hopefully, your recruiter can help you to find locations that will be near your traveling, or maybe find a location prior to your travel. But with the Moderna, for example, my second vaccine was delayed. I had them a few months ago, my vaccinations, and the second one was delayed because they ran out of stock. And fortunately, it wasn't delayed too much, but it was delayed a couple of weeks. Now, had I been a traveler and arranged my next travel assignment, that would cause a hiccup and an issue. And so speak to your recruiter about available assignments where COVID-19 vaccines can be provided. You are impacted, my friends, and I was sorry to start to read about this issue, because expectation is that you'll work along staff as staff while you're there on assignment, and yet, there's this sort of unfortunate, well, you're not really staff, and we're not able to take care of you. I don't know what that is. I think maybe that they feel a strong, that initially, people really didn't have enough information, or they had tons of misinformation. We've discussed that before. And that their loyalty would be to those on staff, and that they might run out. So I would think maybe that could have been part of it. I really don't know. They didn't feel the obligation to travelers that were at the front lines taking care of patients with the potential COVID vaccine, COVID disease, or were actually positive COVID, that they wouldn't want the liability of their staff or their contracted travel staff member being at risk or getting sick themselves. I would think that they would do everything in their power to avoid that, but I don't know. It requires a couple of interviews that people may or may not be comfortable discussing. So, I'm getting my information here, and it's pretty valid and pretty current. So let's move on. Let's see what happened here. I'm going to give you some follow-up that happened with the nurse from that was working in Detroit, Michigan. Her story was frustrating. She actually left I'm sorry. She was not traveling in Michigan. That's her hometown, is Michigan. She was traveling in Washington. She wound up taking her next travel assignment closer to her hometown of Michigan to help Detroit, who was struggling with their own COVID hotspot. This is quoted, "My Facebook friends were posting the struggles Detroit was facing, and then Detroit made it to the news. She believed so strongly in helping that, in fact, she accepted a decrease in she took a lot of deduction in her pay, her weekly pay, when she took the initial contract in the Detroit hospital. I was willing to work for the same low rate as the initial contract because the hospital I am in is truly struggling with staffing needs. My presence was making a difference. For me, walking into a struggling hospital and making a difference for patients and staff is rewarding enough. Wow. She took almost $700 a week less. She never did hear back from anyone she tried to contact at the hospital regarding her vaccine, but she does note that the 2 emergency department managers, both of whom happen to be traveling nurses as well, were able to receive the vaccine. But according to her, no ER travel nurse actually caring for COVID patients are being offered the vaccine. So the 2 that did get it maybe just pursued it strongly enough to get it. So she said, quoting her again, I am religious in the use of my PPE, my protection equipment. I don't go anywhere. I don't have to. I haven't had a haircut since COVID started. Mind you, this was January 2021. I'm not afraid of COVID. I'm afraid of the complications that we are seeing with this virus. And of course, she wants to protect her patients. Again, in quotes, it is very exhausting and defeating to fight for 12 hours for someone's life, shoveling your lunch in your mouth behind a glass window in view of the patient's room while the ED resident is inserting a central line, knowing that this is the only 10-minute break you're going to have tonight because this patient and the multiple drips along with your other patients will now keep you too busy. Just to find out that the patient has passed 2 hours after your shift ended due to the COVID complications. So she really was in the thick of it. My entire being, again in quotes, is exhausted from the COVID, and this vaccine to me is one step closer to a little breathing room in this fight. So she gives a little information, which is if you're a travel nurse struggling and having trouble procuring your COVID-19 vaccine, contact the state or local health department, which is where she started, wise woman that she is. Wow. That's pretty amazing to me. That's just amazing. Sorry, my itchy nose. Am I going to get in a fight? Where's my hand sanitizer? Behind. See my little nurse? I've had her for ages. Can you see her? Yes, some nurses are dolls. That nurse is a doll. Let me wash my hands real quick. If I walk out of here and touch anything or anyone, keep it clean. I think this is a silver lining, actually, that having kept our circle small and having, washed our hands a lot and worn masks and, remember in the beginning we washed, I came in and out of the house from the supermarket or whatever, from anywhere I drove, and cleaned everything that I came in with, left my shoes in the garage. If I brought in groceries, took everything out that was packaged and wiped it with, Clorox soaked sanitizing cloths and alcohol and bleach. And you know what? We had a pretty healthy year. The baby, my daughter was run down in the beginning, and we don't know what it was, but it took her a long time to push out that baby. And I do believe it was just being run down, that she had a lot of cold symptoms. It affected her. She had some side effects with nursing the baby. So she was the only one that was sick, but that was really postpartum. So we don't know. We don't know. But my mom, who has emphysema, has had respiratory issues since she was young and smoked, and maybe had some unchecked respiratory issues or pneumonia that was unchecked and some damage. And then the cigarettes didn't help. She told me she never inhaled. Anyway, but if she gets a respiratory infection, she almost always gets into a bronchitis, an infectious bronchitis or an infectious pneumonia. And so every winter we try to keep her as safe and healthy as we can. But this winter we succeeded. She has not been sick in many, many months. Boy, my nose is itchy again, and I didn't bring in a Kleenex. Okay, this is an old grandma trick. I'll use the tail of my shirt to take care of my itch. Excuse me. What a terrible broadcast. So what other issues might cause a hiccup in your travel assignment? And again, my best recommendation, and here's a shout out to travel agencies and recruiters. Please, please, please come on and talk to me. Easy enough to catch me. You can catch me through the 800 number, 800-737-6518. You can tune in when we're live, and I'll be here for quite a while. Usually here every Tuesday from 10 to 11. Today I'll be here a few minutes longer because I tuned in late. I don't know. This room gets dusted weekly. Maybe it's not enough. It's dry. And I came from a dry area. I was out in the Palm Desert area this weekend, and it was beautifully sunny. We have a lot of gray mornings in May and June in Southern California because we have marine layers. But the desert is almost always sunny and lovely, and it was breezy, and oh my gosh, it was delightful. Anyway, I think it made me very exceptionally dry. So somebody's tuning in. Orhan Sinar, hi, sending some little emoji kisses. Hi, thanks for tuning in. But recruiters, please, 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 I'd love to hear your stories and how helpful you can be to travelers that are seeking vaccinations, whether it be a flu vaccine or an MMR, and particularly a COVID, and what hiccups we've discussed that have happened along the way in the last several months since the vaccinations were available, and how that affected our travelers, and how unfortunate, how very unfortunate. Another hiccup I can think of is licensing. That is going to be a little bit different for the various disciplines, right? So an RN and a nurse practitioner. A nurse practitioner is an RN and is a master's level prepared and licensed NP or FNP, family nurse practitioner, FNP. We talked about all these acronyms. Let me give you some initials for nurse practitioners. Okay, an NP-C is a nurse practitioner certified. An ARNP is an advanced registered nurse practitioner, a little bit of an older term. An FNP is a family nurse practitioner, but you might also see a CFNP, which is a certified family nurse practitioner. And it goes on and on, on and on. We talked about a lot of these acronyms and initials in one of our recent broadcasts. And I mean, I could just spend an hour talking about them. It's amazing. But yeah, so there can be hiccups there too. Let's see if I have a story I can tell you with licensing. And again, I strongly, strongly urge to talk to your travel company, to your recruiters before that hiccup happens in your life. It's for the RNs, I'm more aware of because I was a manager, a clinical manager for traveling RNs, and I just didn't have the nurse practitioner experience, but I know it's different, and I'm going to tell you what some nurse's story, some NP story, or FNP, as it may be. Okay, so traveling nurses are required to have an appropriate license when they travel. So if you are licensed in, for example, New York or New Jersey, and you are traveling to Ohio or Texas, lots of assignments in Texas, you would need to be licensed. And a travel license is a temporary license. You don't get it usually for 2 years. I mean, you certainly could apply for that, but it would take longer. You obtain a license for the state that you will be traveling in. And sometimes it will be known as a compact state. So the compact state licenses may cover more than one state. Like Ohio, I think it covers a couple of states. So as a traveling nurse practitioner, you have to obtain 2 or 3 licenses per state. It's a whole different ballgame. And you need the RN license, then you need the ARNP. Oh, ARNP. Do I have that somewhere? ARNP. Yeah, the Advanced Registered Nurse Practitioner. Gosh. In order to prescribe medications, which nurse practitioners do. And since several licenses are going to be needed for the nurse practitioner, the process can take much longer. So as a travel nurse practitioner, you will also have to make sure that your DEA certificate is changed in each state. So, you know, it's just a lot of stuff. That the DEA is needed, of course, for controlled substances. So, yeah, the scope of practice generally for an RN is not too different, but it may be different. And that's why it's really, really important to get as much information from your recruiter before traveling, and to try to have a conversation with your nurse manager, particularly those that are working nights, because the manager may only float to nights from time to time, unless it's a bigger facility and they have night managers and day managers. But the onboarding and the orientation, it's going to vary from travel assignment to travel assignment. And I always recommend carrying a little tiny little pad in your pocket. This is not just a little spiral pad. This is a little bit of a hardcover, but it's awfully cute with the dots on it, isn't it? But a little, you know, a dime store little spiral notebook in your pocket, and have your questions ready. And if your onboarding or your orientation doesn't talk about policy and procedure and standards of practice, you may want to ask. So in some ERs, you can start IVs and do all the things that you're trained to as an RN or as a nurse practitioner. A nurse practitioner may prescribe meds, narcotics, etc., x-rays and everything. And then in certain states, there may be some further regulation about it and so forth. So I behoove you to get in touch with your recruiter, to talk to the manager in a state that you're about to go to, particularly if you're new to traveling. You know, knowledge is power, and you want to, you know, have a great experience and be appreciated. And you know, so you will need some, not necessarily supervision. Okay, Orhan, this is for nurses, and we're not going to talk about being friends on Facebook. So yeah, I think you're mistaken here. Anyway, so yeah, so your clinical settings are going to be similar, but there'll be little tweaks that'll occur. And nurse practitioners in one state may work very independently, and in another state they may work much more closely and cohesively with the medical staff. So you need to, and licenses too. I was hoping to give you a personal story from a nurse practitioner because they listed one. Now we get on with pay. There are some similarities, but there are some differences. No, there's no quotes. Okay, so this was posted by a nurse practitioner, but didn't talk about a personal experience, except to share that if you're a nurse practitioner, you are going to need potentially more than one, certainly more than one, maybe several different licenses that you have to apply for. So the path is a little different and will take a little longer. And I do believe a nurse practitioner can still work as an RN and carry that RN license. So maybe if it's a nurse practitioner and she's, you know, really feeling strongly about wanting to help during the pandemic, and her area of expertise is the ER, she could potentially just travel in a state as an ER RN, or maybe take the first travel assignment as an RN and then switch to the NP as the licensing and the DEA certificate and all those things come in. So I don't need to tell, I don't think, too many of you about the differences in the scope of practice and the settings and so forth, because I think that you're quite familiar. Let's see if I can give you some rate differences. I'll give you some travel rates. If they're broad, and they're going to vary from company to company and state to state, but the nurse practitioner rates will be higher, and you certainly probably spent a good amount of time and money on your nurse practitioner education, so it'd be nice to get the higher rates. So these are travel nursing rates for nurse practitioners, or their various titles. ARNP, NP, CFNP, CFNP, and more. Okay, so California is one of the higher ones at almost $134,000 a year. New Jersey's up there, over $122,000. Alaska a little even higher, closer to $123,000. Massachusetts, $123,000, and New York, $121,000. So those are the top 5: California, Alaska, Massachusetts, New Jersey, New York. But I'm sure the other states aren't far behind, particularly with the needs being what they are. Here's a little bit of a little blip about the similarities between travel nurse practitioners and travel RNs. Both travel RNs and nurse practitioners are able to, of course everybody knows when I say RN, I'm talking about a registered nurse. Okay, both travel registered nurses and travel nurse practitioners are able to travel around the country for free. Housing and travel are paid for. Licensing fees are paid for or reimbursed. The average assignments are often 13 weeks or 3 months in length. Travel RNs and NPs, now we're going to abbreviate: RN, registered nurse; NP, nurse practitioner. Even though we know there are many, many acronyms that go with those two, they're both in high demand, okay? And the pay is a little bit more for travelers. They have to be to entice you, and they're usually going to be more than the permanent staff. But the permanent staff, it's a choice, and there are packages for permanent staff that aren't necessarily there for the travel nurse. Retirement packages and education packages and raises, and so forth, sick pay and so forth. It's a whole different ballgame. But the pay rates are usually a little bit higher, so that's something that the nurse practitioner and the RN have in common. Working with a recruiter or a travel agency is going to be imperative and necessary if you travel as an RN or an NP, and you both have tax advantages. And we did have a wonderful, wonderful financial planner, and I am trying to recruit another, not recruit, but I'm trying to connect with another specialty finance person to be a guest on our show, because I think it's just different. It's a different world for travelers, right? And that's why this channel, I think, is getting the followers that we have, because we want to share with you what we know and find out what you know, and have it be a hub and a place where travelers can connect, and those that employ travelers connect, and just share, casually or formally, whatever suits you best. But to have the information out there that you may be thinking about, or your friends or someone you know. But there are tax advantages, and you certainly want to know about that. Opportunities for those that travel are broad and strong, and we've talked about that in the past too. So it's it's the travelers that I know that I've spoken to, a lot of them knew right away that that was something they wanted to do. They have an adventurous spirit. They've traveled personally. Oh, there was a wonderful nurse that I interviewed about a year ago, and she kind of got into it by accident, and she had a wonderful time. And she is, I think, initially from back east, and she might be a nurse practitioner by now. She was getting her education. She was absolutely delightful. I'm going to look her up and invite her to come speak to us again. But I think she sort of got into the travel thing by accident. She has family in Europe and in the States and so forth. And so she likes traveling anyway. She had some hiccups. She was assigned to do a certain job. She got to the travel assignment. They had her do a different job. And she went with the flow. And she just is so positive and so bright and made such a difference. She worked. I talked to her early in the COVID. And she worked during that, and she shared some of her experiences. So, so travel nurses and travel registered nurses, travel nurse practitioners do have some similarities, and the biggest one being that they're very much in demand in the travel industry. That they will get a better pay than they might on staff. And that there are tax advantages, and they have the opportunity for the adventure of a lifetime, and that they will have strengthen their healthcare portfolio, their skills, and their the things that they learn and share along the way just add to their personal, professional portfolio. So these are just super positive things. And yes, there are hiccups. We talked about the vaccine hiccup, the COVID-19. Hopefully that is more or less resolved, but the advice there is twofold. One, talk to your recruiter prior to your assignment, whether you're partially vaccinated or need both your vaccines, and get their input on how you can get your COVID-19 vaccine if you haven't already. And two, if you are mid-assignment or on assignment and having trouble, go to the Department of Health, whether it's the local or the state, or the county. So those are going to be helpful to you if you come across that. I hope at this point that anybody working in healthcare is vaccinated if that is their choice. And I don't understand why not, but I guess I do. And I do think it's the faith or the lack of faith we may have in our bureaucracy that may be a part of it. Maybe you've had bad reactions to vaccines, but I think in some areas of healthcare that the choice to not be vaccinated will prevent you from getting some jobs that you want. So it's personal. I get it. I'm not recommending one way or the other, but I want you to be healthy and strong. I appreciate everyone that tunes in. I'm hoping very soon one of our next guests will be someone that has been an educator to me and has helped me maintain my advanced life support and my basic life support for many years. And her stories, her name's Beverly. We've been playing phone tag quite a bit, but she is, I'm sure her stories will be of interest to you. And travelers, stay up to date on all your credentialing as well as your vaccinations. What else can I say? We're still looking for the right LVN in Southern California for a unique opportunity in wellness and weight loss. So give us a call, 800-737-6518. You can go to our website, travelnursechannel.com, and find out lots of good things there. See who some of our, I want to say clients, but they're actually our sponsors. We have sponsors on the Travel Nurse Channel, and we welcome all recruiters, anything anyone has to offer to travelers. This could be a site for you. I think we have a sponsor that provides housing for travelers, and it's ever growing. So we welcome people to watch. Tell your friends, and tune in next Tuesday at 10 a.m. Pacific Standard Time. And I'll talk to you then. and I appreciate you very much. Please stay healthy. I'm going to sign off on my little commercial girl, who I think is so cute. Well, my two friends, my two travel friends on the commercial. Enjoy. Take care of yourselves. Bye-bye.
Travel nursing can bring you to places you've never been before. Tell us your story.